Hi guys, welcome back to my channel. So today I want to talk about nursing home nursing versus hospital nursing, and can you do you learn about the same? Do you learn more in one field versus the other? Um, you know, is the learning even? I would tell you just from my experience, I used to work in long term care. I did that for 6.5 years, and then I went to the ICU in hospital. So, two totally different worlds. I will tell you that. Uh, totally different type of nursing, and I will kind of touch on that in this video, but I do want to make a separate video going more in depth about nursing home nursing versus ICU nursing, and even just hospital nursing. But I'll probably make a different video on that, like more in depth. But today will just be um, just we're just going to touch on it a little bit. So the first thing, can you or do you learn as much in a nursing home setting versus in a hospital setting? Again, like I said, from my experience, I will say yes and no. You will, you do learn a lot, but different. It's different type of learning. So in in the hospital, you have your patient for a very limited amount of time, for a small amount of time. So there's only so much you can do for that person. Mainly if they're in the hospital, it's pretty it's extreme. You usually it's like life threatening. So your main focus is just keeping them alive. You know, versus in a nursing home, you are mainly you're dealing with older people. There are some nursing homes who will take younger people in, but 98% of the time you're going to be having geriatric patients, and their issues are chronic. They We're not really looking to cure anything, sometimes even to treat it. It's just more like they're reaching the end of their life, they're reaching the end of this disease process, and we just want to make them as comfortable as we can during their last few years, you know, that sort of thing. So, again, like I said, in the hospital, you're going to have this person for a limited amount of time, and you just want to get them healthy enough to get back out into the streets, to get back home. Whereas in a nursing home, you are dealing with them sometimes for years. So in the nursing home, it's more the nursing that we did focus on health, getting them, their medication, slowing down the disease process, but we weren't really trying to cure it. We knew there was no cure for it. But aside from that, the nursing that I did there, we focused more on their diet, and seeing the nutrition. How is can they handle it anymore? Do they need to have a different form of diet now? Does it need to be pureed, liquid diets, things like that? We also focus on their mental health, their emotional, their spiritual health. We did a lot of trying to make sure they maintain their activities of daily living, a lot of physical and occupational therapy, things like that, keeping them, mobile, and then just initiating a care plan, and then waiting a month and documenting it and seeing how is it going, is it working, do we need to change something else. So we're really able to just focus on that person, like the whole person, their whole health, every aspect of their health. How are they sleeping at night? How's their emotional health? Are they crying a lot? Do they seem depressed? Are they more angry? uh, so yeah, things like that. We we really, in the nursing home, uh, you really just got to thoroughly take care of the person, as best as you can, to try to get them, the best quality of life as you can. And what I have seen in the hospital, especially in the ICU, you don't have your patients for long. They're either going out the door in a body bag, or they're leaving your unit and going on to a different floor that needs less, where they need less intensive care, less monitoring, things like that. So I can only speak on what we did in the ICU as far as taking care of patients. And in the ICU, as I said, they are near death, so our main focus is keeping them alive. We don't really care about emotional health, mental, spiritual health, really. We just want your heart to keep beating. We want you to wake up from that coma. We want your organs to be functioning. We want to clear your body, rid it of infection, of sepsis, or whatever it may be. So yeah, there is just very much so focused on the health and the body, and just getting you where you can talk to us so that you can tell us how your emotional health is. And usually by that time, once if you're able to start talking, and we can get to that point where we're talking about food and you know mental health, emotional health, things of that, it's time to transfer you out to another unit. So definitely, definitely a big difference there. um, I appreciate that I got to experience both, because if I had not gotten the experience from the nursing home, I will only know this ICU experience of just keeping the person alive. I wouldn't really have any practice of, being able to go more in depth, being able to, notice mental and emotional decline. And so, and that's very important. I'll make a video on that as well, about how our mental status, our emotional status really does affect our health. And yeah, so just a quick little video I wanted to do on um, yeah, on this topic. So I'm gonna be uploading quite a few more. um, so yeah, hope you enjoyed this. Hope you learned something. I hope it was helpful to anybody. And let me know if you guys work in a nursing home, or if you've worked in like both a nursing home and a hospital. Like, what do you think? Do you think you can learn just as much in either setting? Do you think one makes you better than another? Um, I do have a video kind of on that. Is nursing home real nursing? And I'm gonna clue you in. Yes, it is. But yeah, leave a comment. Let me know. All right, thanks, guys. Bye.